Hello, I'm Director Park Sang-wook from Leo Animal Hospital. Today, I'll share the treatment story of a 14-year-old Pomeranian named Dubu with a mammary tumor. At our hospital, Pomeranians are the breed we have treated most frequently for mammary tumors using tumor necrosis therapy. A mammary tumor developed near the first left armpit. Fortunately, the first treatment was completed successfully. As you can see, the first injection treatment was given on February 22, 2025. 2 days later, the tumor was completely necrotic. And on April 29, 2025, after just over 2 months, the treatment was completed. Since the location is the armpit, it typically took about a month to remove the skin tumor, but the wound did not heal properly afterward. So, from February 24, 2025, to around March 20, about a month, the scab over the tumor fell off, indicating the tumor had been removed. However, due to irritation in the armpit area, the treatment was somewhat delayed, but it was successfully completed on April 29. Recurrence must be managed from now on. Therefore, other patients are also undergoing very similar adjuvant chemotherapy. We advise the guardian to proceed with neurosurgery now. Since you came from Uiheimbu, please visit a local hospital to have the surgery done. I mentioned that stopping the production of female hormones is crucial for managing recurrence afterward. But you absolutely refuse to undergo surgery. In that case, 2 progression phases will occur each year at 6-month intervals. In this case, there is a risk of recurrence of the mammary tumor, and the tumor cells that have already metastasized may grow rapidly. Therefore, if you decide not to undergo neutering surgery at this time, it may be fine at other times, but during progression phases, you must take hormone blockers. There is a significant difference in the rates of metastasis and recurrence of mammary tumors. Regarding Dubu, when I asked how he had lived over 14 years, they ate a lot of beef. Not only beef, but they grew up eating almost every kind of meat that their owners had during meals. So, I was a bit worried, but the blood test results showed that the kidney, liver, and spleen levels were very healthy. These are values rarely seen at this age. How can the liver, kidneys, and spleen remain so healthy despite consuming such a high-fat diet? Ironically, this is the role of female hormones. Female hormones are one of the 4 major hormones that regulate fat metabolism in a dog's body. So, what does this mean? If Dubu undergoes neutering surgery, he will likely gain a significant amount of weight, making it hard to see these measurements. Therefore, Dubu's guardian refused the neutering surgery and decided against it. In managing initial and recurrent cases, this is the most important part. We are now managing the acidity levels. So far, Dubu has shared meat at every meal, including grilled beef, but from now on, he will only eat cabbage. By eating only cabbage, we will manage the pH levels. Before starting cabbage, the pH was acidic like this. After eating cabbage, the acidity associated with dementia shifts to alkalinity like this. Without this, it's quite difficult to prevent tumor metastasis and recurrence, and it's also hard to anticipate effective outcomes from chemotherapy. Besides this, many other adjunct therapies are being used, and Dubu is currently being cared for. In cases like Dubu's, where surgery is practically impossible or the guardian does not want surgery. When mammary tumors occur in elderly dogs and cats, this treatment can be used to treat them. Whether it's renal failure or not, when anesthesia is practically impossible, this method can remove mammary tumors in dogs and cats. And when very small breed dogs and cats become seniors, anesthesia is considered practically impossible. In such cases, mammary tumors can be removed without surgery. In fact, the treatment cannot prevent metastasis and recurrence. So, in fact, chemotherapy is the most effective method to prevent tumor metastasis and recurrence. When the dog is very old, often even this chemotherapy cannot be performed. There are adjunctive cancer therapies available when chemotherapy cannot be performed. Currently, our tumor treatment protocol includes 4 types of therapeutic agents. So among these 4 therapeutic agents, it would be ideal if there was a primary response right away, but For very old or large tumors, the likelihood of continuing treatment to the third or fourth therapeutic agents is very low. So, at first, there is the disadvantage that we cannot know which of these 4 drugs the patient will respond to. As you have seen, tumor removal and recovery take about 2 months, with some variation around that time. So, the recovery time is quite long. During that process, needing a lot of care for the child is a drawback. If you want to remove mammary tumors without anesthesia or surgery, please contact Leo Animal Hospital. Thank you.